Once you have symptoms of CFS, this is where your neuroendocrine system is noticeably beginning to break down. What is your neuroendocrine system? The neuroendocrine system responds to external stimuli, such as temperature, pain, and stress. CFS is a symptom of your neuroendocrine system being tapped out. It's much like a tag team cage match in the WWE. Our body is the cage where stress and fatigue are in a bout for the championship against neuroendocrine. Stress and fatigue, the bad guys, end up being the winners against the neuroendocrine, the good guys. The good guys can only take so many chairs to the back and pile drivers before they lay down for the 3 count. When it comes to treating CFS that doesn't have underlying medical issues, how do you do it, and where do you start? Most people start with their primary care physician and stop there too, all because they are told that their tests are normal. If you are lucky, a doctor will throw some anxiolytics or antidepressants at you. Unfortunately, it's been another few months and you still feel like the undead. Most people don't know where to start when their doctors have left them high and dry. Actually, most of those with chronic fatigue syndrome wouldn't be in the position if they knew how to properly take care of themselves to begin with, and that includes myself. Lots of people want a quick fix and don't want to own what they have done to themselves, either knowingly or unknowingly, to create their current CFS predicament. There are 3 main causes of chronic fatigue syndrome that don't have underlying medical issues. Those reasons are stress, diet, and constant physical stress. If you really think about it, there is really only one non-medical issue, which is constant physical stress. You may be wondering, how did we go from 3 to 1? It's easy. Emotional stress and diet both place constant physical stress on your body. It is worse than being the aforementioned WWE wrestlers. When you are under constant psychological stress, whether it is due to work, living situation, or your need for perfectionism, yes, we stress ourselves out. The physical harm on your body is the same. Your neuroendocrine system is constantly taxed, causing all kinds of internal chaos. Your autonomic nervous system is on high alert all of the time, and your adrenals are tapped out. Humans are not designed to live under constant stress, be it psychological or caused by diet. So what are some of the common causes of chronic fatigue syndrome? Myalgic encephalomyelitis, also known as ME. If you have medical issues, some of the causes can be anemia, depression, medications, viral infections, bacterial infections, mold sensitivity, unresolved Lyme, and more. But is it really chronic fatigue syndrome if there is a medical cause? No, not really. Stress, diet, and constant physical stress are other non-medical contributors. There is a wide variety of reasons that are the causation of chronic fatigue syndrome. For most of the medically induced causes, there are tests for the underlying issues. If you have a good doctor, he or she will offer up to do some basic blood tests to see what the underlying reasons are. Hopefully, you will have a good doctor. We'll leave that subject for a different post. Let's focus on non-medical causes of CFS. So what's a girl or guy to do? First, own it. Stress and diet are more likely than not the reason. Second, come up with a plan of action. I know, you're seeing this and thinking there is no way you did this to yourself, and the stress in your life is somebody else's fault. External stressors are the catalyst, but the way you react or deal with that catalyst is the match that burnt your whole life up into flames. Change your perspective. It's hard and sometimes seems impossible, but it can and has to be done. Cut that stress up and throw it away. You have to take care of your soul to find peace. The next step, change the food you eat. You know the old saying, you are what you eat? Well, it's true. Most of the food that we eat today is processed and isn't even food. Do you know what EDTA and BHT, BHAR? EDTA, ethylene diamine tetraacetic acid, is a chemical found in dormant plants that is now manufactured. Its side effects include abdominal cramps, nausea, vomiting, diarrhea, headache, low blood pressure, skin problems, and fever. BHT and BHA, butylated hydroxytoluene and butylated hydroxyanisole, are chemicals used as a preservative. They can cause allergies, inflammation, cancer, ADHD, lesions on the liver, tumors, biochemical changes, cell mutation, asthma, endocrine disruptors, and neurotoxicity, just to name a few. These added chemicals to your food are in almost every package you purchase. They are also fat soluble. If you don't know what that means, it's that they are stored in your fat, so they build up in your system. Ladies, guess which gender naturally has more fat stores? You guessed it, you. And you wonder why women suffer from chronic illnesses such as chronic fatigue syndrome and fibromyalgia more than men. Plus, think about it. If you're 40 years old, you have been eating this poison for almost your whole 40 years on Earth. Wonder why you feel terrible? There you go. Most people feed their dogs better than they feed themselves. So there you have it, my friends, the ugly truth. The number 1 and 2 treatments for chronic fatigue syndrome is to get rid of the stress in your life and the poison in your food.